Thanks, Luis Miguel Rodriguez, a student at West Texas A&M University. First, I'm going to show you my room. Today, we're going to be conducting a comprehensive head-to-toe assessment. The patient has already completed the general survey. We went over his past medical history, his past surgical history. Patient's not taking any kind of medications. We've assessed cranial nerve number 2, the optic nerve with the Snellen chart. His visual acuity is 20/20 and bilaterally. I've washed my hands, and now we'll begin this. Well, we will begin the assessment. We'll start with with inspecting his head and scalp, making sure everything's nice, even, feeling the texture of his hair, noting any kind of tenderness, lesions, or anything. It's evenly distributed. We're going to move over and just take a look right at his face. I want to feel his temporal pulses, make sure they're present. That +2, perfect. Next, I'm going to assess his ears and his eyes, making sure they're symmetrical on his head, which they are. Okay, next we're going to be looking at his eyes. Going to be testing trigeminal nerve, cranial nerve number 5, the trigeminal nerve. Just tell me if it's sharp or dull whenever I run it around your face, okay? Sure. Dull, 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 dull. Perfect. Okay, next we're going to be looking at his eyes. I want to look. Um, we're going to be looking at inside of his eyes, his sclera. Going to look at his lens, his iris, and his conjunctiva. We can look and see if there's any yellowing, if it's pale or light pinks, dehydration, kind of jaundice. But I want to be testing his visual, his direct and consensual. If you look at me, direct, consensual, consensual, direct. And next we want to check accommodation. Okay, if you look at the wall, pin, the wall, pin, perfect. Okay, next we're going to be testing cranial nerve number 3, 4, and 6, ocular, tricolor, and the adducens with the 6 cardinal fields of gaze. Okay, if you just follow my pin. Perfect. Okay, next what I want to do is take a look inside of his eye with the ophthalmoscope, look at his discs with this red light. I'm gonna hold stabilize his head with my hand, gonna look inside of his eye. Okay, gonna look, make sure he's got sharp disc margins. Also looking for any papillary edema, any AV nicking. Look at the other side of his eye. No papillary edema, no AV nicking. Perfect. Okay. After that, we're going to take a look at his ears. What I want to do is we're going to do is test his temporal mandibular jaw joint. I'm going to take 2 of my hands. Going to go right here. Should be able to fit 2 to 3 fingers. If you open your mouth for me, okay, move your jaw left and right. No abnormalities noted. Okay, gonna take a look at his arms and his fingers. Hold it like this, making sure that his hair is evenly distributed on his arms and his hands. His nails are trimmed and neatly groomed. What I'm also checking for is capillary refill, is vascularity in his limbs. They less than 3 seconds. No abnormalities noted. Also, we're going to move back up and look at his ears. What I want to do is just inspect his ears at first, making sure they are evenly placed on his head. Okay, I'm going to palpate, note for any tenderness or anything on his auricle or on his tragus. Then all I'm going to be looking at inside of his ear and look at his tympanic membrane. I'm going to pull his ear, the pin up and back, and look inside of his ear. Going to describe his tympanic membrane, which is pearly gray, no bulging. Ear canal is not narrowed. Nice and clean, minimal cerumen noted. And I'll check on the other side. Pearly white, no bulging. Bulging or redness or narrowing of the canal could indicate an infection, inflammation. So we got that. Then next I want to go ahead and conduct a whisper test. As here's the hearing. Okay, so I'm gonna say a number and you repeat it. 66,
66,
55.
55,
Perfect. So next we're going to move on to the Weber and Rhine test. Weber test, we're going to check for lateralization on his ears. Okay, so what I'm going to do is hit this, put it in the middle of your head, and you tell me if you feel. Perfect. Next we're going to move on to the Rhine test. No lateralization noted to his ears. We're going to move on to the Rhine test. We're going to check bone conduction versus air conductions, which air conduction should be twice as much as the bone conduction. Okay, are we ready? Tell me when you stop.
stop, stop,
Okay, perfect. You're going to check the other side.
stop,
Perfect. Abnormalities. Check cranial nerve number 8, the auditory test, as well when we did the whisper test. Next, what I want to do is move on to his his nose. We're going to be looking at inside of his nose, noting any kind of moisture, dryness. Going to look at his septum, make sure it's midline. If you look up for me, we're going to do this. We'll look up, nice and pink, no swelling, turbinates are not inflamed. All right, perfect. Good deal. Septum's midline. And I'm also going to test the smell, cranial nerve 101, and openness. Tell me what you smell, okay?
well,
Perfect. I'm going to press on one side of his nair and see if he's kind of congested. Okay, that side. Perfect. Okay, next what we're going to do is we're going to go ahead and inspect cranial nerve, his hypoglossal, pharyngeal, nerves in his mouth. Okay, if you open, we're going to look, open, perfect. Can you go ahead and stick your tongue out for me? Perfect, say ah. What I'm assessing is making sure that there's no lesion, bulges, inflammation noted. All right, I'm also going to check his gag reflex, cranial nerve number 10. Okay. Okay, open for me. Perfect. Okay. Also, look and stick your tongue out. Move your tongue side to side for me. Perfect. Okay. Got that done. Okay, next what we're going to do is do the shrug test on his shoulders. Go. Perfect. Okay. And then I'm going to test his, moving on to his neck. And I'm going to look at his neck, make sure there's no lesions, any abnormalities going on there. Okay, if you just take the strength of his neck, touch your shoulder, touch your shoulder, touch the other shoulder, go back, go forward. Perfect. Okay, next what I want to do is test his thyroid. What I'm going to do is stand behind him. I'm going to palpate, make sure, feeling for any nodules. Okay, I'm going to have him swallow. Perfect. Any edges? Nothing. Good deal. No nodules felt. Okay, thyroid's good. Okay, next what I want to do is going to palpate his lymph nodes. We start with the preauricle, postauricle, submental, submandibular, cervical, postcervical, supraclavicular, axillary. Okay, no nodule felt. What I also want to do is going to go ahead and palpate his sinuses. If you look up for me, we're going to take his frontal. Tell me if you have any tenderness. On his maxillary. No. Okay. Yeah. Also look at his carotid. Going to test. what I want to do is listing right now. What I'm listing for is for any brewery or witches. That's the other side, one at a time. Okay, everything's within normal limits. Next, what we're going to do is we're going to go ahead and turn. We're going to listen to his going to check his posterior part of his chest right here. Okay, what I'm going to do is check for tactile fremitus. Going to feel, say 99 whenever I'm moving my hands.
89. 89. 99.
Okay. Next, what I want to do is going to go ahead and percuss all the lung fields, looking for that resonance. Okay, next, what I want to do is go ahead and auscultate. Take nice big deep breaths for me. Okay. Good deal. What I'm doing is looking for any adventitious sounds, any bronchi, bronchi, or wheezes. Also, whenever I was percussing, any kind of dullness would indicate any kind of pleural effusion, any kind of pleural effusion, any kind of pneumonias, which none was found. While I'm back here, I'm going to go ahead and test for the cost vertebral tenderness. Is that right?
No.
One time. No tenderness. Any tenderness would indicate any kind of possible of infection. Okay. Also, what I want to do is I'm going to test for echophony, bronchophony. If you would just say 99 whenever I put
99. 99.
and say E.
E. E.
Okay.
E.
Okay, perfect. And within normal limit. What we're going to do now is we're going to turn and we're going to look at the anterior part of the chest. Okay, I'm going to also percuss. Also notice for any pleural effusion. Okay. Okay, next what we're going to do is we're going to auscultate and we're going to listen for any more adventitious sounds like crackles, bronchi, wheezes. Deep breath. And also listen to the lateral part of the lungs. Deep breath. Okay. Things good there. Next thing I want to move on is we're going to listen to the heart. If you lean forward for me and bring that apex of the heart to the front, I'm going to listen to that spot. I'm going to go ahead and listen to the apical, which is located on the right second intercostal, the pulmonic, which is on the left second intercostal, the Erb's point, which is on the right, the left sternal border of the third intercostal, and then the tricuspid which is the left sternal lateral of the fourth intercostal, and then we'll got the mitral, which is on the uh, left fifth intercostal, the midclavicular line. I'm gonna go ahead and take a listen. Got the aortic, got the pulmonic, herbs, tricuspid, mitral. Okay. Assessing for S1 and S2. Now I'm going to flip the bell of my stethoscope over. We're going to listen for any murmurs. No murmurs noted. And while I was doing all that, I was assessing the skin and the hair, make sure everything's evenly distributed, make sure there's no moles or any abnormal nodules, lesions, or anything on his skin. Next, we're going to go ahead and move on over to have the patient lay down on his back. Okay, what I want to do is assess his jugular vein distension. What I'll do is I will get my little centimeter ruler, then I'll get a flat piece of paper right here. We're going to look for the pulsation of his jugular vein at the maximal point. We're going to take our ruler, put it right here on his subclavicular, then take the little piece of paper, then measure. Perfect. Okay. Next, what we're going to do is we're going to go ahead and move on to his abdomen. We're going to look at his abdomen. Okay, go ahead and make the shirt. Perfect. All the way. Here we go. First, we're going to inspect, make sure that it's midline, any nodules, skin or anything. What I want to do is going to go ahead and auscultate, making sure his bowel sounds are there. I'm going to start each quadrant. We'll go with the right upper, right lower, left lower, left upper. And while I'm listening, I'm going to go ahead and take a listen at the aorta, make sure we don't have any kind of occlusion in the aorta. Also going to assess the renal arteries on the right, renal artery on the left. Make sure we don't have any kind of bruit or any kind of frill, any kind of occlusions going. Everything's present. Next, what I want to do is I'm going to go ahead and going to percuss. Going to percuss the liver edges and look for the spleen edges as well. I'm going to start percussing on the left side, going superiorly up to the liver base. Going to percuss. Okay. Whenever we find the edge, we'll go on the left side on the upper, right below the nipple line, and we'll be going inferior down till we hit the edge. Measure that, make sure it's not enlarged, which it's not, and we'll move over to the spleen. We'll go ahead and percuss the spleen, looking for tympany. No dullness noted. Next, we're going to go ahead and move on to the palpation. We're going to do light palpation first, and we're going to note for any kind of tenderness. We're going to be looking at his face for any kind of facial grimacing. We're going to do light. No tenderness noted. Okay, then we're going to go ahead and move over to deep. And what I'm going to do is I'm going to put my hand underneath his back and go for deep palpation. Use my right hand underneath his left side and come up. Go ahead and relax. Go deep palpation. And I also palpate for the kidney. Any tenderness?
No.
Okay, then we're going to go look at the other side. Okay, deep palpation. Go for the kidney. No tenderness. Okay, there's that. Okay, then go ahead and have the patient put his shirt down. All right. Then we're going to move on to test the range of motion. Go ahead and lay down. We're going to test the range of motion in his hips. We're going to have him lift his left leg and dorsal flex his foot. Okay, up. Here we go. Dorsal flex. Then we're going to go ahead and abduct, adduct. Then we're going to internally rotate, externally rotate the hip. Perfect. Okay, we're going to go down. We're going to note any kind of pain whenever he lifts the leg. It could indicate any kind of spinal or nerve damage. We're going to also lift this other leg and we're going to test the other side of the hip. The left hip, lift up, dorsal flex the foot. We're going to abduct, adduct. We're going to externally rotate, internally rotate. Perfect. No abnormalities found. Next I want to do is the knee. We're going to test the range of motion in the knee. We're going to do the same thing. We're going to lift the knee. We're going to extend and flex. Extend, flex. Then we're going to externally rotate, internally rotate. Perfect. Okay, we're going to go down. We're going to test the left knee. Go up. We're going to flex, extend. We're going to externally rotate, internally rotate. Perfect. Any pain?
No.
Perfect. All right, then we're going to look at his ankles. Do the same thing with his ankle. Dorsal flex, any pain? Check range of motion in his ankle. Okay, right here. I'm going to go ahead and remove his shoes and we're going to look at his pulses while we're looking right here. Okay, we're going to go ahead and rest right here. We're going to test his popliteal pulses right here. Dorsalis pedis pulses. Posttibial. And while I'm assessing his pulses, I also want to note, assessing his peripheral vascularity, noting any swelling, edema, any lesions, any fluid retention could indicate signs of CHF or vascular abnormalities. While I'm checking his pulses, I'm going to look at his brachial pulses. Radial pulses. Everything's +2. We're going to check his femoral pulses. +2. And while I was assessing his femoral, I was looking for any kind of hernias, inguinal hernias. None was found. Next, what we're going to do is we're going to go ahead and have him sit on his side. Sit on the side of the bed here, please. Perfect. We're going to assess his range of motion in his shoulders. Go ahead and lift your arms up. Give yourself a hug. Perfect. Put your arms behind your back. This. Perfect. And we're going to go ahead and look at his elbows. Range of motion his elbows. Extend. Flex. All right. Then going to go ahead and now we're going to look for range of motion. We're also going to check tendons. We're going to check his tendons in his biceps, or his triceps first. We're going to go right here in his triceps. Go ahead and relax. Give me your arm. Perfect. Triceps. Perfect. Going to go right here. Bicep. Give it to me. Cut down. Perfect. Then we'll check his radial pulses. All right. Then we're going to check the other side. Perfect. Give it right here. Relax. I'm going to check his bicep tendon. Perfect. His brachial. Okay, now it's radio. Okay, perfect. And we're going to get his patellar tendon. Look at his patellar tendon. Okay, here we go. Okay, and then the other tendon, relax. Everything's 2+. What I want to do now is assess his strength in his head. Okay, I want you to turn your head against my, okay, other side. Perfect. Now we're going to test his arm strength. Turn it up like here. Pull it. Okay. Push. Same thing with his legs. Push. Pull. Perfect. Okay, everything's 5 to 5. His tendons are +2. Now what I want to do is test his cerebellar function. Go ahead and have your hands straight out. Turn. Back and forth. Test the cerebral function. Perfect. What I want to do now is going to have the patient stand up. What we're going to do is do the Romberg test. Going to test for ataxia. So close your eyes. We're going to assess, see if he has any kind of swaying, which is not noted. Next, I'm going to assess his gait whenever he walks. Heel to toe for me. Perfect. Perfect. Okay, now back. Perfect. Okay. No abnormalities noted. Go ahead and have a seat. All right. So next, what we're going to move on to is we would actually do on a female, we would do a breast exam, and I'll examine the breast with the chaperone and with her consent as well. Is in 4 positions: hands to the side, hands to the hip, and hands to the back of the head. And what we will do is we'll assess the breast around in a circular motion, going out and in, and we'll be feeling for any kind of nodules, any abnormalities, any painful spots on her breast, and any swelling. And then we'll also be palpating the nipple, making sure there's no discharge or any kind of tenderness going on there. And the same thing for the males as well, is we'll be doing the outside, making sure if there's any tenderness or any kind of swelling or any abnormalities with the breast exam. Next, we're going to move on over to the rectal exam. We'll have the patient lay over on his left side with his knees to his chest. We will have gloved hands. We'll have the appropriate lubricants. This will give me an opportunity to assess for tone, any kind of hemorrhoids, fissures, and any other abnormality that's going around the anal area. Once that we get through visually inspecting the anus, then we will go ahead and do the digital rectal exam. I'll lubricate 2 gloved fingers inside the rectum, and we will go counterclockwise to feel for the prostate and inside the rectal, and we're going to feel for the lobe of the prostate for any nodules, any painful tenderness, any kind of swelling, and we'll continue counterclockwise until we get to the other side. For the same thing, any other tenderness or nodules noted in the rectum, and then we'll take hand out and just continue to finish with the rectal exam, and then we will do the female. We'll go ahead and inspect the penis. We'll inspect the head of the penis, the foreskin, making sure that there's no lesions, any kind of drainage, any kind of abnormalities. We'll lift the scrotal sac and look at the posterior part of the scrotum, see if there's any kind of abnormal findings, any lesions, any nodes, any kind of tenderness, any redness. We'll also look at the epididymis and the spermatic cord, see if there's any kind of tenderness whenever we palpate. We'll also inspect the shaft of the penis to make sure that there's no other lesions or tender areas there. And that's what we'll do whenever we inspect the penis. And then whenever we move on over to the female pelvic exam, we will have the female lay on her back. Of course, we'll have a chaperone and consent. We'll assist the female into the lithotomy position. I will make sure that the patient is draped from her abdomen down to her knees. She'll be in the lithotomy position, and we will have the speculum, the appropriate size speculum. We will insert, first we'll do a visual inspection of the mons pubis, the labia majora, labia minora. We'll take a look and look at the outer part of the vagina, make sure that there's no any kind of swelling abnormalities. See if there's any kind of lesions, nodes, or any kind of any abnormalities. And after we'll do that, we'll actually take the speculum, appropriate size speculum. We'll insert it, turn it clockwise, and open it until we can see the cervix. Then we'll lock it in place, and we will observe the cervix, the cervix, the os. Make sure that there's any redness, any inflammation. Any drainage could indicate any kind of bacterial vaginosis um, or candidias. Look for any kind of abnormalities with the vagina. Then after we get finished inspecting the vagina, we'll get the broom of the pap smear test, and we'll sweep the cervix, and then we'll send that off to the lab for any kind of results, any results, any kind of abnormal results. After we get through doing that, we will loosen the speculum, take it out, and then finish with the pelvic exam. When we get through with that, we will then also do the rectum exam for the female as well. While she's in the lithotomy position, we will inspect the rectum. Same thing for a male. We will look at the anus, make sure that there's no any abnormalities. Then we will do a rectal and a deep rectal to see if there's any kind of cancer in the higher part of the rectum while we have her in the lithotomy position. Whenever we get finished, then we will finish with the rectal, finish with the pelvic exam, and then we'll have the patient sit back down, and that'll complete that. Whenever we get finished with that, then we will go ahead and test the patient's the number. We'll have the patient have his hands out. Okay, then I'm going to draw a number, and you close your eyes. We'll tell me what that number is. Okay.
6. 6.
Okay. Then we'll have him identify an object. When I put it in his hand, keep your eyes closed. What are you holding? One hand.
Some sort of rubber.
Perfect. Good deal. All right. And then what I want to do is go ahead and have your hands out. All right. And tell me which hand I'm touching.
Okay. Left. Right.
Okay. Then we're going to look at his toes and tell me which way I'm pointing the toes up. Okay. Keep your eyes closed. Tell me if I'm going up or down.
Up. Down. Up. Down.
Okay. Perfect. All right. That concludes our head to toe assessment this evening.